Honor, the state calls Dr. Piotr Kubiczek to the stand.
All right, Dr. Kubiczek, would you please stand and raise your right hand? Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
All right, you may be seated. Proceed, Ms. Akert.
Doctor, can you hear me all right?
Yes.
Could you please state and spell your full name for the record?
My name is Dr. Piotr, P-I-O-T-R, Kubiczek, K-U-B-I-C-Z-E-K.
And doctor, how are you currently employed?
I'm employed at the West Virginia office of the Chief Medical Examiner in Charleston, West Virginia. I'm First Deputy Chief Medical Examiner.
And about how long have you been a medical examiner?
I've been working here since 2017, so it's almost 5 years.
In your best estimate, about how many autopsies would you say that you've performed?
Correction, almost 8 years. I have performed altogether in my career more than 6,000 autopsies.
Dr. Kubiczek, where did you attend school?
I attended medical school. It was Medical University of Warsaw, Poland. And then I studied graduate medical residency. It was pathology residency in Muncie, Indiana. This was Paul Memorial Hospital. Then I proceeded to study forensic pathology. It was my fellowship at Montgomery County Coroner's Office in Dayton, Ohio.
Do you have any work experience prior to being a medical examiner for the state of West Virginia?
Yes, prior to work here in West Virginia, I worked in Nevada. I worked over there at Clark County Coroner's Office in Las Vegas, and I worked at Washoe County Medical Examiner Coroner's Office in Reno, Nevada. And before that, of course, I worked at Montgomery County Coroner's Office in Dayton, Ohio. And before that, I worked at a residency program. It was Paul Memorial Hospital in Muncie, Indiana.
And are you currently licensed to practice medicine in the state of West Virginia?
Yes, I am.
Do you have any teaching experience?
Yes.
Could you just briefly lay that out for us?
Since my residency training, I've been teaching medical students and residents in practice of autopsy and pathology. And then now I teach the medical students practice of forensic pathology here in West Virginia.
And outside of that teaching experience, have you given any presentations in the field of forensic pathology?
Yes, it's a part of it was part of my work to give presentations. For example, in Nevada, about the cause and manner of death, different types of causes of death, and how they refer to manner of death.
Are you a member of any professional organizations or committees?
Yes, I'm a member of International Association of Coroners and Medical Examiners, and I'm a member of College of American Pathology, and I'm a member of Association of I'm American Society of Clinical Pathologists.
Your Honor, subject to voir dire by the defense, I would request permission to treat this witness as an expert in the field of forensic pathology under Rule 702.
All right, Mr. Selden, do you wish to engage in voir dire of this witness?
I just have a few very brief questions.
Very well.
Dr. Kubiczek, have you published any articles, books, or anything of that nature?
During my forensic pathology fellowship, I was co-author of article on toxicology involving pediatric population in Montgomery County. Besides that, I published, presented a letter to editor on injuries of residents that occurred during the autopsies. Basically, those are the most important articles or the presentations in the journals.
All right. Thank you. And Dr. Kubiczek is certainly acceptable as an expert in forensic pathology.
All right, the court declares Dr. Kubiczek to be an expert within his field of forensic pathology. You may continue, Ms. Akron.
Dr. Kubiczek, did you have occasion to perform an autopsy on a Michael Cochran on or about September 4th of 2019?
Yes.
And did you generate a report following that autopsy?
Yes.
Your Honor, at this time I would like to have the autopsy report marked as State's Exhibit 20.
Okay.
Now, Doctor, that autopsy was performed approximately 7 months following Mr. Cochran's death, is that right?
Yes.
Can you explain the long window between the death and the autopsy occurring?
Initially, Mr. Cochran's death was considered a natural death, so the hospital and the hospice actually did not report the death to us. Later on, law enforcement became involved, and it was determined that the post-mortem examination should be performed, and on not the court issued order for exhumation. And then I performed the autopsy on exhumed body, Mr. Cochran.
Did you review any outside medical records when you performed this autopsy?
Yes.
Can you review what those were for us?
There were records from Raleigh Hospital and then CMC Memorial Hospital, and those were the major sources of information.
And when you performed this autopsy, were you looking for anything in particular?
When we perform autopsy, we look for the evidence of natural diseases on the surface of the body, and then inside the cavities of the body. And of course, we look for the evidence of injuries on the surface of the body, inside of the body. The body that I received in the coffin, it was already moderately decomposed, and however, it was also post status of embalming. And this kind of helped a little bit to preserve the internal organs. The process of embalming helped me to visualize better the organs in the body that was on the outside of this was moderately decomposed. And I performed the, as I said, the external examination, internal examination, and I did find that he had cardiomegaly, that means enlarged heart, and obviously there were those decomposition changes present. And I sent out tissues that I obtained during the autopsy for toxicologic examination. Basically, the toxicology results showed that there was no alcohol, there were no common drugs of abuse. We also tested for heavy metals, and basically at that point, after reviewing the medical information, clinical information, after reviewing the autopsy findings, toxicology findings, I came to a conclusion that the cause of death is at this point undetermined. I could not find basically cause of death beyond certainly the medical science.
You answered my next 4 or 5 questions for me right there in that answer. Dr. Kubiczek, has anything come to your attention since originally performing the autopsy that would change the opinion that you offered?
No.
And had you been looking for anything specific at that time, as in this case we're talking about exogenous insulin administration, would you have performed any different testing that you did not perform with the original autopsy?
Actually, no, because the body was already moderately decomposed. It was almost 7 months after the deceased's death. So, looking for areas of, for example, insulin injection or the presence of insulin in the deceased system was basically not possible at that time, because we have to understand he spent a few days in the hospital, and later on he was obviously buried. So lots of the evidence that would help to determine if there was actually insulin used was not available anymore during the post-mortem examination.
Thank you, Doctor. I have no further questions for this witness, Your Honor.
All right, cross-examination, Mr. Selden.
Good afternoon, Dr. Kubiczek. My name is Stanley Selden. I am co-counsel for Natalie Cochran, and welcome this afternoon.
Good afternoon.
Now, you conducted, I'm gathering from your answers, a very detailed and thorough examination of Michael Cochran's body when you received it, and it was exhumed 7 months after his death. Is that correct?
Yes.
And you said that you reviewed the medical records from Raleigh General Hospital and CAMC in the course of your autopsy. Is that correct?
Yes.
In your autopsy report, you have a list of diagnoses that I believe you received from the discharge report of CAMC. That's on page 5 of your report. Is that where those diagnoses came from?
Yes.
Okay. And the clinically documented diagnoses were that the decedent was unresponsive at home during unclear circumstances. That's the first one, correct?
Yes.
There was a reported prolonged time of unconsciousness, correct?
Yes.
You list in number 3 that there was use of testosterone augmenting supplement. Is that correct?
Yes.
Prolonged hospital stay, and then you list cerebral edema with hypoxic ischemic encephalopathy. That's fluid on the brain and swelling of the brain. Is that a correct interpretation?
Yes.
You list hypoglycemia at the time of admission. You do not know the cause of that. That's just the discharge note, correct?
Yes.
There was a history of seizure disorder and diagnoses, correct?
Yes.
And he was in a coma, right?
That's correct.
Now, there was noted in your autopsy and on these diagnoses that he suffered from cardiomegalia, which was an enlarged heart, correct?
Yes.
After all these exams, all this review of the medical records, your very thorough report and toxicology, etc., you found that the manner and cause of death was undetermined, correct? And undetermined means you don't know why he was deceased, and you couldn't tell from the autopsy, correct? That's all my questions. Thank you.
Redirect Ms. Cochran.
Dr. Kubiczek, you analyzed the organs of Mr. Cochran, is that correct?
Yes, that's correct.
Did you locate any tumors on or inside of the body or on those organs?
No.
And the hypoglycemia that was listed in those records, would you consider that profound hypoglycemia?
Hypoglycemia is less than, I'm not really a clinician, treating patients, live patients, but it was, at the time of admission, was significant.
And the information that you received in the medical records, do you know the original source of any of that information?
There was testing done at the CMC Memorial, the follow-up testings. But that was the medical records, those were the sources of information. Obviously, I could not verify this during the autopsy.
Thank you, sir. I have no further questions.
Anything further, Mr. Selden?
Very, very briefly.
Go ahead.
Dr. Kubiczek, the reason you couldn't find tumors, microscopic tumors, etc., because this body was 7 months old, and the organs are the first thing to decompose. Isn't that correct?
Yes.
No further questions.
Anything, Ms. Cochran?
No, Your Honor.
May this witness be excused?
Yes, Your Honor.
Thank you very much, Doctor. You are excused.
Thank you.